Understanding the 4 levels of heart failure. Heart failure is a chronic and progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs. The American Heart Association, AHA, and the American College of Cardiology, ACC, have identified 4 stages of heart failure, which are used to classify the severity of the condition and guide treatment decisions. Stage A. High risk of heart failure. Stage A heart failure refers to individuals who are at high risk of developing heart failure, but do not yet have symptoms or evidence of heart damage. This stage includes individuals with conditions such as high blood pressure. Uncontrolled high blood pressure can increase the risk of heart failure. Diabetes. Diabetes can damage the heart muscle and increase the risk of heart failure. High cholesterol. High levels of low-density lipoprotein, LDL, cholesterol can increase the risk of heart disease and heart failure. Family history. A family history of heart failure can increase an individual's risk. Stage B. Asymptomatic heart failure. Stage B heart failure refers to individuals who have developed heart damage, but do not yet have symptoms. This stage includes individuals with left ventricular dysfunction. The left ventricle of the heart is not functioning properly, but the individual does not have symptoms. Previous heart attack. A previous heart attack can cause damage to the heart muscle, increasing the risk of heart failure. Stage C. Symptomatic heart failure. Stage C heart failure refers to individuals who have developed symptoms of heart failure, such as shortness of breath. Feeling winded or short of breath, even when sitting still or engaging in light activity. Fatigue. Feeling tired or exhausted, even after resting. Swelling. Swelling in the legs, ankles, or feet due to fluid buildup. Coughing. Coughing up pink, frothy mucus. Stage D. Advanced heart failure. Stage D heart failure refers to individuals who have advanced heart failure and are experiencing severe symptoms, such as severe shortness of breath, feeling extremely short of breath, even when sitting still or engaging in light activity. Severe fatigue, feeling extremely tired or exhausted, even after resting. Severe swelling. Severe swelling in the legs, ankles, or feet due to fluid buildup. Confusion. Feeling confused or disoriented due to lack of oxygen. Treatment and management. Treatment and management of heart failure depend on the stage and severity of the condition. Common treatments include medications. Medications such as ACE inhibitors, beta blockers, and diuretics can help manage symptoms and slow disease progression. Lifestyle changes. Making healthy lifestyle changes, such as eating a balanced diet, exercising regularly, and quitting smoking, can help manage symptoms and slow disease progression. Device therapy. Devices such as pacemakers and implantable cardioverter defibrillators, ICDs, can help manage symptoms and prevent complications. Heart transplantation. In severe cases, heart transplantation may be necessary. Conclusion. Understanding the 4 stages of heart failure is essential for making informed decisions about treatment and management. By recognizing the signs and symptoms of heart failure and seeking medical attention, individuals can receive timely and effective treatment to manage their condition and improve their quality of life. Recommendations. If you're at risk for heart failure or have been diagnosed with the condition, here are some recommendations. Work with your healthcare provider. Collaborate with your healthcare provider to develop a treatment plan that's tailored to your needs. Make healthy lifestyle changes. Eat a balanced diet, exercise regularly, and quit smoking to help manage symptoms and slow disease progression. Take medications as prescribed. Take medications as prescribed by your healthcare provider to help manage symptoms and slow disease progression. Monitor your symptoms. Keep track of your symptoms and report any changes to your healthcare provider.